Michael from ReleaseWorks, where we help people get out of pain and improve how their bodies work. Today I'm going to be talking a little bit about how to help low back issues. It's a big problem for a lot of people. We've already been talking through what happens as you start working through the issues and you end up actually feeling more pain. It's a typical thing. I'm going to bring Chris on, one of our therapists here. He's been doing this himself, working through his issues and constantly flaring up every day. Some days it's better, some days as he keeps working, it's worse. Common thing, typical. Chris, if you come over here, please. So would you show people what you've been working, how you've been stretching and moving like we've been showing? Just real quick.
So I've been going into range of motion, sinking into SI joint areas. Any areas that feel like it doesn't want to go, I'll sit there longer and get it to soften into it.
Perfect. So he's been doing what we tell people do. We want to recover the mobility, the motion of these joints right here. When he said SI joints, that's the sacrum ilium joint right here on either side. They get locked up and bound, and he's been settling, sinking into them and helping those joints get unbound, able to move again. Now that leads to a lot of soreness to start because they're not working perfectly yet. At some point, as you've been freeing those up, you just keep getting more sore. And you kind of want to stop focusing on them. It's really easy, it hurts, let's stretch it, let's twist it, let's move it. That's a good beginning, but at some point it plane needs to kind of stabilize and other things needs to move. So when you're at that point, this is what I like to do. If you'd mind lying face down, please. So when I wake up is a good time to do this, or at any other time during the day when things are getting sore through here and achy and all over the place. First, just plain allow this area to soften and settle, and you'll feel your hips kind of starting to move this way, your sacrum here in the middle starting to move kind of down in. You can kind of feel the area settling a little bit. Very subtle motion. Not even a motion, more an allowing. Getting some of that, Chris?
Yeah.
Okay, so you can stay with that for just a little bit, a minute, two, until it starts to feel a little bit easier. Then you can start to add little tiny movements through your low back. Kind of picture, if you can, how your spine must be moving. It's a whole chain of articulated joints that each have to move in a variety of ways. If anything's bound up, you're going to be having trouble. So if you, let's assume we've been here for a little bit, just starts to move and shift a tiny bit so that you can feel things in subtle ways happening through these joints. Can you feel that?
Mm-hmm.
Okay. See, and we're not seeing any visible movement, so everybody tends to move way too big. It's small, tiny, subtle. A little bit here, a little bit here, a little bit here. From here to well, that's even big. From here to here is significant in there. So think smaller and slower. As those starts to free up a little bit, you can start to come up onto your elbows a bit. You can start to arch your back a little bit. Well, arch this way with the back hanging down. So bring up your shoulders a little bit. Come up on your elbows a little bit. We're going to speed this up faster than we would go. I might spend 5 to 10 minutes doing this. And that continues to add this compression and backwards bend into your low back. Now with little subtle movements, you can move a little bit to the side here on your shoulders, which adds a twist, a rotation and a side bend down here at your low back. You can go the other direction. And I know that we've talked myofascial release, you need to spend 5 minutes releasing tissues. This is not quite that. This is more getting things moving and lining up and getting them a chance to unkink. If they're thoroughly stuck, they need 5 minutes or more to release those tissues. But this is kind of a recover after things have settled somewhere and gone back to the normal patterns. We're just getting them moving and lubed up again. Just do this based on how things feel in your body. Does it like more of a twist? Does it like more of a bend? Does it need to go more this way or that way? Gradually, you're going to work through most of your spine. Come up a little bit more, again for the sake of time. Allow this to sag a little bit more. Even pull your chest forward, not your shoulders. Keep those up more. Pull this down. There you go. See the difference there? Show it again. You went more this way, which didn't do anything here. Pull this down and into the table this way. Squeeze these up and back. There you go. Now you're getting a nice back extension. We're encouraging the spine to go in ways it doesn't normally go. A little bit of that, and again, a little bit of twist and side bend to either side. Pick this way first. And just keep it gentle and easy, breathing through your spine. Let go of some of that squeeze. We don't really need to work hard at this. And it's more about breathing and moving and lubricating those joints, giving them a chance to unkink. Try twisting a little bit and looking over your shoulder. You'll feel that extends up through your neck and your upper back more. And the other side. And allow that to reach down into here. There you go. And it's more about just breathing and moving, freeing things up again. And spend 5, 10, maybe 15 minutes there if you like. Waking your spine back up. Let up on that a little bit and starts to just move how you want to, as if you're going to come up. Like a next good step would be up onto all fours, knees and hands. And now you continue with the typical cat-cow idea. And it's really easy to get focused on. You got to spend 5 minutes. That's true. I'm not contradicting that. But this point, when everything just kind of seems flared up and aggravated, you plain need to move the rest of your body to take the stress off of these joints that keep getting forced out of place. And actually, stop stretching those sore spots all the time. It doesn't help much once you get to that point. You want to move everything else and give these a chance to stabilize where they need to be. Now, if you feel them twisted up still, if you feel them unable to move, you do need to continue to deal with that. They need to be able to move. But if they're moving and sore, sorry, I'm out of frame. If they're moving and sore, you need to move other things to take the pressure off of them. Okay? And let us know how it goes.